Wait, Kathy, are you crunchy?
Am I crunchy?
Yeah.
I feel probably more so yes than no.
I think it's a funny term. It means lots of different things, but I was at a bachelorette this weekend and I guess I said a few things and they were like, "Oh, so you're like crunchy." I'm like, "Am I crunchy?" And then I was like, I lean crunchy." I'm like, "What is this
That's
vocabulary
so
that I'm
funny.
using?" But I think I am. I'm like, I don't know. I eat like a lot of whole foods,
I've
but
become a lot more like that, like not processed foods. I stopped drinking a couple years ago because I'm like, I did it mostly because I was like, I need to lose weight, but my body just like, I can have like a glass of wine or like one cocktail and my clothes don't fit. I get so swollen and bloated. Like, I don't know.
yeah,
I hate drinking.
That's so good,
I
and that's
can't.
so like, so many people are doing that now.
Mhm.
I love it.
Yeah. I
Mhm.
mean, alcohol is really bad for you. So,
It's horrible. You're listening to One Body, where we talk about health and science. I'm Cruzy. I'm a physician associate.
I'm Eden. I'm a speech language pathologist.
You only get one body, so take care of it.
We're trying to have a good time, but we're not trying to waste your time.
Okay, let's get into it. Okay, wow. We're joined by my friend Kathy. Kathy's a PA, physician assistant, and we had the true pleasure of going to Emory University together for PA school. I feel like anyone that I went to PA school with, I have like such a deep connection with. Even if I can't keep up with everyone, I'm like, we went through it. Okay.
no, we
We
really
went
did.
through. We really did. Okay. It was during COVID too. Emory's right next to the CDC, so we were just inundated with like COVID facts all the time. So anyway, that's how I know Kathy. Kathy works in ENT, ears, nose, throat. She's actually doing surgery, but she does some clinic too. And she's just a super fun, well-rounded, smart human being. She was actually the president of our class,
Sheesh.
voted in. Yep. And she did a great job. And also kind of like the class clown. Like you just
Yes.
kept everything fun and lighthearted, which we needed. I needed. I was like so hardo during PA school. So I needed someone like you leading the ship. So thank you for being here. I want to know one fun fact about you.
Okay. One fun fact about me is that I speak 3 languages.
Oh my gosh.
That's crazy. Which ones?
English, obviously, Farsi. So my family's Persian, and growing up, they wouldn't let my brother and I speak English in the house because they were like, "You're gonna learn English at school. You can speak Farsi." And Spanish. I learned in high school and then in college, like halfway through, I realized I was a couple courses away, like 4 courses away from being able to get a minor, and I was like, well, actually, I want to take medical Spanish. And there were a couple other literature classes I took. And I don't use it every day, but when I travel to a Spanish speaking country, it like fully comes back. I also love listening to Bad Bunny. So like
Yeah.
I listen to that on the way to work like every day. And I'm like, wait, I'm actually probably kind of more fluent than I thought.
That's good because he speaks so fast.
Yeah. Yeah.
Did you like the halftime show, the Super Bowl?
Yeah.
Yeah.
Yeah, I liked it. It was different than I was expecting, but it was good. He like mixed together a bunch of his songs, so it was fun.
Yeah.
And then also I'll have Spanish speaking patients every now and then, and I'm not technically allowed to speak the Spanish that I know
Mhm.
because I haven't taken the like certification, but sometimes we'll be using the interpreter and I'll just cut the interpreter off and like finish the sentence and the patients will
Yeah.
like, oh wait, and then they'll start speaking really fast and I'm like, wait, no, I can't conjugate verbs that fast. I forgot. I feel like it actually it helps patients connect sometimes. Sometimes they're alone or they're like with one family member, but just like realizing, oh, hey, someone here understands me. I
Mhm.
think that's made them. I've seen it like light up their face and they feel safer and then they'll like request me next time. So makes me feel
Aw.
important.
Aw, I bet you're the best PA. Okay, love it. What surprised you most about PA school?
I think what surprised me most was the amount of content that we learned and how fast we had to learn it, like just absorbing the information. Everyone tells you PA school is like a full-time commitment. And like I went into it, like I don't have kids, I don't have any family members that I have to take care of, I don't have pets. But even for me, I was like, how are people managing this? It's a lot. Like
Yeah.
full-time your job. But I also still found a way to be more social than I was before. I think just for the sake of like,
Sanity.
yeah, exactly. Yeah. I wasn't
Yeah.
able to see my family as much, but I was talking to them. And I guess it was during peak COVID as well. So that was a little bit harder. But just, you have to find little things that you can do during PA school to keep you sane, basically.
Yes. Yeah.
And
I
now
was
it's all a
just,
blur.
I know, right? It's like drinking from a fire hose,
Mhm.
truly. And it's
Yeah.
a marathon. It's like a sprint marathon.
Yeah. Yeah.
Yeah. Is working as a PA what you thought it would be?
I think so for the most part. So my hospital doesn't have residents, so it's a lot of responsibility on the APPs because I don't work with multiple doctors, it's just me and my one doctor. And she used to work at Emory, so she came from like 25 years at Emory. So she's used to having residents and like multiple residents, and so like interns and then chiefs and fellows and all of that, and having a PA. So I have to fill the role of multiple people, but it's fun. I have a lot of autonomy, and she trained me well and she trusts me a lot, so I get to do a lot, which is rewarding, but there's a lot of responsibility on me.
Yeah, I'm sure.
Yeah.
Okay, what's like the craziest thing or the coolest thing you've done as an ENT PA?
Okay, I wrote down like a couple things because I was like, wait,
Yeah,
I
go
like
for it.
do really cool things. And I feel like sometimes my friends like don't know my friends who don't work in healthcare, or like my family, like I'll go get dinner with them and I'll just tell them about my day and they're like, okay, we can't finish our meal now. That's gross. I can't believe you did that and now you're here. So I think cauterizing nosebleeds is so crazy to me because, yeah, there's the anterior ones where you just cauterize with like silver nitrate and then they stop bleeding and you monitor them, But the ones that have like the heavy posterior bleeds, that's really scary. So we pack those with, it's like a thrombin factor. It's called Flow Seal. And you got to like really get in there, like get back there. And sometimes it's bleeding heavily and it's like, it just starts spewing out. So I think there were a couple
Yummy.
instances. I know. There were a couple instances where I was like, "Oh my goodness, I can't believe I just did that."
Like, are you wearing goggles?
I mean, like I should be. No, I
But it's an
don't.
emergency, so you just run in there
Yeah.
probably.
And then another crazy thing that I do that I like do so regularly, I'm like, wait, this is crazy. So when our thyroid cancer patients when it starts to metastasize or when it spreads, the first place it goes is to the lymph nodes in the neck, and then the chest or the lungs are the next place. But we do neck dissection. So we do an incision from this ear all the way down, all the way back up to this ear. And my favorite part of surgery, of course, is like when my surgeon scrubs out and I'm closing and I'm just like chilling, closing this neck up. But I'm like, this is crazy. Like this is a big scar that they're gonna have for the
Yeah.
rest of their lives. So what I like is I'm very detail oriented. So anesthesia will be like, can you hurry up? If you don't like wrap this up, we're gonna have to redose antibiotics. Or nurses are like, well, there's no Foley in, so the patient's gonna void. And I'm like, guys, this patient, like all they're gonna remember or know or take away from the fact that they had this surgery is their scar. So I really try to make it look perfect, and I take my time, but it's like, okay, if you have to give another dose of antibiotics within reason, like why wouldn't we take 20, 30 extra minutes and make it look good?
That's so cool.
Yeah.
Okay, well, today we are talking about seasonal allergies, which is great timing because I'm currently dying. My nose is so stuffed. My eyes are itchy. I'm breathing out of my mouth every night, and I just feel like I have this prolonged cold. And also, I'm just grossed out every time I walk outside because everything's yellow. And I did learn, guys, in Atlanta, this is the second highest pollen count for like early season ever recorded. Crazy.
What?
I know.
Mhm.
So it makes sense that people are dying. But we wanted to just first talk generally about like what even are seasonal allergies, and then we'll ask some questions about how to manage it and go from there.
So, seasonal allergies, which is known as hay fever or just allergic rhinitis, it's an allergic reaction that involves the immune system mistaking a benign substance, so the allergen, so in this case, pollen or grass, weeds, molds, whatever it is, but in this case, because we're talking about pollen in the spring and seasonal allergies, so it mistakes it for a dangerous invader when you're breathing it in or when you're exposed to it. So this response begins with specialized immune cells produce a type of antibody called IgE. known as immunoglobulin E. The IgE antibodies attach to mast cells and basophils, which are immune cells found throughout the body. And so upon subsequent exposure to the same allergen, it binds to the IgE antibodies on the sensitized cells, and that triggers the release of histamines. And the release of histamines is what causes the symptoms that we have. So the runny nose, the itchy eyes, itchy skin even, breathing problems, swelling, things like that.
Wait, I have a question. So a dangerous invader, that sounds really serious.
Yeah.
Is it a dangerous invader? Like, is it good that our body's having that reaction, or is it like disproportionate?
So it's benign. It's not actually a dangerous invader, but it's just something that the body isn't always being exposed to. You want the body to react, but also it's annoying that you have those symptoms.
Yeah. Okay.
If that
Okay.
makes sense.
And it's so short term, like it's seasonal. So it's almost this like transient response. Your body's reacting and then it kind of balances out.
It is seasonal, but leading to our next question as to why it's so bad in Atlanta, it has to do with the climate and climate change. So I learned that because of climate change, I think it was in 2025, the pollen started like 20 to 30 days earlier and they ended 10 days later than they had the previous couple years. So allergy season is starting to get longer because of the climate change.
It's actually year long. It's going to be
Yeah,
year
and
long
then
eventually.
depending on the things that or the types of pollens and trees and grasses and ragweeds that each person is allergic to. So in the fall, some people have worse allergies. Most people, it's in the spring, but for some people, it's in the fall. It's just depending on when those trees and stuff are blooming.
And it's so bad in Atlanta because some people don't know this if you don't live here. Atlanta is like the canopy city where there's so many trees here. I always thought Atlanta was just like concrete. But then I moved here and I was like, oh, there's trees everywhere and there's like bushes and flowers everywhere. It's beautiful. But yeah, it's spreading pollen everywhere.
Yeah.
So,
And so in other states or cities, it's not as bad because, I mean, it just depends. Like you said, there's a lot of trees, but it depends on the kind of trees as well.
mm,
Yeah.
that makes sense.
Yeah.
And then why are only some people impacted or certain people impacted a lot more than others?
Yeah, so there's a few different reasons. So there's a genetic predisposition, of course. There's environmental factors, so where you live, and then there's this thing called the hygiene hypothesis. And that suggests that early exposure to a variety of microorganisms and parasites can help the immune system learn to tolerate allergens. And so this is why some people may not have allergies in their childhood, but develop them later in life.
The other day, Palmer, my baby, was going down a slide, and it was like the first time someone had gone down the slide is in our neighborhood for that day, and it was covered in pollen. And she, of course, decided last minute to flip and go down face first. And I was like, oh, do you? Whatever. But she got up, and there was just pollen. Like she had inhaled, ingested. It was all over her mouth. And she was like, plet, plet, plet. And I was like, well, this is kind of going like, hopefully helping with the hygiene hypothesis because she's like getting really exposed to it, you know?
Yeah. And
So,
I mean the genetic component too. So there is a higher likelihood if the parents, one or both of them, have the allergies. But like for me, my parents don't have allergies and I have terrible allergies. So it's
yeah,
just
interesting.
Just to clarify the hygiene hypothesis, were you saying if your child is not exposed to these allergens early on, like then it might show up later in life? Like it might seem random, but it's because they didn't have
So it, like
the exposure.
if you grew up like somewhere else, and then that's the story I see a lot with patients is they're like, oh, I grew up in like New York or in Colorado and I never had this issue. I moved to Atlanta a year ago and like I can't seem to breathe ever and this is terrible. And it's like, well, you weren't exposed to the same types of pollens and trees and grasses and things. So you weren't exposed to it. And now your body is reacting to it and trying to accustom to it.
Okay. Yeah, it's interesting because I never felt like I had allergies or experienced allergies until this year. And I didn't know if it's like, oh, I turned 26 and I'm the age where you have allergies. Like I feel like I always hear older people complain about allergies. I don't hear little kids talking about it and maybe they just don't have the words for it. But yeah, it's interesting because I was outside. Like I feel like I was pretty dang exposed, but maybe I'm just more aware of my body as well.
Yeah, I mean, you can develop allergies at any time in your life, unfortunately. So even though you grew up pretty close to here, right? You guys, Chattanooga's
Mhm,
not that
mhm.
far. Probably the same trees and everything as well. Some might be a little
Yeah.
different, but it wasn't that far away. But yeah, allergies can change, which is
Mm.
frustrating.
Mhm.
It's kind of wild. The other thing that I was looking into is if pregnancy impacts your seasonal allergies, because I actually feel like compared to normal, I'm doing a little better and I'm pregnant. And so I'm like, maybe there's a thing there. But I looked it up and it's like it's so variable. For some people it's the same. For some people it's actually better. And then for like 10 to 30% of pregnant women, their symptoms are worse. So, it's just one of those things where you're like, there's no true correlation, but could change things. Pregnancy can change anything. So,
Yeah, I was gonna say pregnancy. I feel like it's just like a free for all when it comes to any
yeah.
symptom in the body, and
Yeah.
yeah, you don't know how it's gonna react.
It's so true. Okay, let's get to the meat. The stuff that probably everyone really wants to hear about is how we deal with and manage our allergies. So, I want to talk about lifestyle. I want to talk about traditional like medicine and then also some alternative things you can do if there's anything that's been shown to work.
So the first thing is like lifestyle. Of course, before we try any medications, I always want to try lifestyle modification. So when the pollen season is bad, like right now, there's a lake that or a pond I'm looking at outside my window, and it's like yellow. It's disgusting. So I keep my windows closed. I don't want that flying in. And you can use or make sure you change out your air filters that the indoor air filters that you have because those can get kind of gross over time as it accumulates dust and things like that. Make sure that when you come from outside to inside, you change your clothes and you shower. Yeah, I know. It's like common sense, but like think about it. So like I go on a lot of walks and I mean, as a woman, I don't want to wash my hair every day, like styling
No.
it and everything, but that pollen that I'm accumulating in my hair is then coming into my home. It's getting on my couch, on my bed, and my pillow sheets, and then I'm breathing that in because I'm rolling around in it in my sleep. So it should be common sense, but like it's actually not.
No.
Vacuuming and sweeping regularly, cleaning your kitchen and your bathroom, and then you can use a dehumidifier in your home as well because breathing in the pollen is drying out your nasal mucosa as well. You can wear a mask when you're outside. I think that's like too much, but I've seen people wearing it and I'm like, I don't think they're doing that for COVID. They must have like pretty bad allergies, which
Yeah.
sucks because I myself had to use my inhaler last week. And then just checking like the daily pollen counts before you go outside. So there have been a couple days where it's been so high. I'm like, I'm not going to go on a walk because I'm going to feel terrible afterwards. So I just go
Yeah.
on the treadmill inside the gym in my apartment.
Makes sense. The other thing that I've heard people say is if you have a dog, that you
Mhm.
should like wipe it down at least
Mhm.
before coming inside,
Yeah.
especially like I have friends who I have a friend who was like, why like I'm doing everything. Why am I struggling so much at night with my allergies? And their dog like sleeps in the bed with them.
Yeah.
I'm
Yeah.
like, well, your dog's probably rolling around in the yard and then just getting it all in the sheets for you every night.
Yeah. Yeah. I mean, it doesn't take long for like a layer of pollen to accumulate on something. I went to lunch yesterday and we were sitting outside and like I watched when the server put the silverware down. And by the time our food came out, like all of our forks had a layer of pollen on it.
Ew.
So it accumulates pretty fast. We were like, actually, oh,
Oh.
can we get another one? But yeah, so like things that you don't normally think about, like change your clothes and like don't just come in the same clothes and lay in your bed because then that's all in there. So changing out washing your sheets as well, probably a little more frequently during pollen season might help if you have allergies.
Mhm.
Okay, wait, I have 2
Mhm.
thoughts. Number 1, I've been listening to so many podcasts recently, and they're like, "Spring refresh, you need to burp your house," which is essentially like open the windows, open the doors, get some fresh air in. I have been doing that all day, like every single like the past couple weekends, and now I'm just thinking maybe maybe not, like, when the pollen is, like, really, really
Yeah.
bad. Maybe I should burp the house, I don't know, before the pollen comes, after, or maybe never. Maybe this is not a good recommendation. And then my second thought is my car filter, way
Oh,
overdue. I thought it was a scam. They're like, "Ooh, you need to get your filter
Yeah.
changed at every oil change." I'm like, "Not tricking me." But now I'm thinking, "Wait, that's probably really important." I mean, I don't know if it is.
I think it is
But
too.
you're breathing it in, right?
Yeah.
Like it's air, outside
Yeah.
air.
Yeah.
Okay.
that's a good point. I will say you can buy a cabin filter, like the air
Mhm.
filter, for so cheap and do it yourself. It takes 2 seconds and it's just way cheaper.
Okay, maybe I'll do that. Probably
Or
won't.
Richmond can do it.
Yeah.
Yeah. Okay, so that was lifestyle.
Yeah. So I have some little things I can show you. I wish this stuff was sponsored,
Alright.
but like I don't make money off of it. So okay, the first thing I recommend is a nasal saline rinse. So it's just like there's different kinds. There's like the neti pot. There's like that big machine that you can like use, which I don't think anyone needs that. This is my favorite kind to recommend to patients. So it's a little saline bottle. It has a little like this thing on it. So what you do is you take one of these saline packets and you put it in, and then you fill it with water to like right here. And you always want to make sure you use distilled water. So don't use tap water ever. If you want to make your own distilled water, just boil it, let it cool to room temperature. Never put hot water in your nose. I have to say that because patients have put boiling water in their noses. So just, I have to put that out there. Let it cool fully. And then, so you put it in, you close this, you shake it up, make sure it dissolves. And then a lot of people don't know how to properly use this. So you want to tilt your head forward over the sink like this much. And there's a little hole in this like nozzle thing. And you don't want to put it straight up in your nose because that's just going to go on your septum or your turbinate. So that's not going to do much. You want to tilt it back and outwards a little bit. And then the pressure when you squeeze this bottle, the pressure helps push the water in to rinse the back of the nose and the sinuses and everything. If your septum is super deviated, which mine is, these things make it very hard to push through. But you can try on either side, and it's just the pressure that it goes through that really helps clean everything out. The next thing I don't have, but nasal like a corticosteroid spray, so something like Flonase, fluticasone, Nasacort. You can use those, but if you're prone to nosebleeds or you notice that you start having nosebleeds, don't use it because it dries your nose out. I think Nasacort causes less nosebleeds than Flonase, but Flonase is pretty drying. So you can always take an oral antihistamine pill. So this is the generic for Allegra. I have Allegra. You can use Claritin. This is Zysol, Zyrtec, whatever you prefer. Just make sure it's a 24-hour acting one. It might not feel like it's covering like or holding you over for 24 hours. When that's the case, I mean, for a couple days, if you take an extra one within a 24-hour span, and nothing bad's going to happen. But I learned about this when I started working in ENT, which is this is called Astepro, but azolastine is the generic name. It's available over the counter as well. It's a nasal antihistamine spray. So like this is an oral antihistamine. This is a nasal antihistamine, and you can use them at the same time. I do warn people or patients, this tastes terrible. Like I avoid this at all costs, but a couple weeks ago it was so bad. Like I was nonstop coughing and I just felt like feverish and ill and I like couldn't get up. I finally used this and I stopped coughing for 24 hours. It was crazy.
Wow.
Yeah. And that's when I also had to use my inhaler and I haven't had to since, thankfully. But yeah, those are a few things that you can use, all available over the counter.
Any
Nice.
tips for the nasal sprays? Is that also not up, but more back?
Same thing.
Okay.
Yeah. The nasal sprays, you will feel dripping in the back of your throat when you use that method. It's okay, but I mean, it's going through the nose still. You'll taste it regardless, but when it's dripping in the back of your throat, it's not exactly where it needs to be. But same, yeah. You don't want to just go straight up. You want to kind of lean forward and put like deeper in and then towards the side.
Can you clarify again how an antihistamine works? I mean, it's just blocking that.
Yeah, the release of the histamine.
Okay.
Yeah.
And then like the oral versus the nasal
Yeah.
antihistamine, like any recommendations for when to use those or when to not?
Yeah.
Like if you're going to choose between the two?
Perfect. This goes into my next point. Okay. So it depends on your symptoms. Usually, first line is oral, but if you feel like, so at baseline, if you don't have what we call nasal obstruction, which sometimes people have a hard time distinguishing between nasal obstruction versus like allergies or sinus problems. But nasal obstruction is basically the swelling of your nasal mucosa. So we have the septum, which is the midline cartilage in the nose, and then we have what are called turbinates. They're these three little like bumps in the nose on each side. And those areas can get swollen. So you can have what's called turbinate hypertrophy, which is the nasal mucosa just swells. And then same with septal swell. And you may not have this at baseline. It may be caused because of allergies. Some people have it because of acid reflux as well, because when the acid comes up from the stomach, it irritates the back of the nasopharynx, which is the back of the nose and the throat. And then sinus infection can also cause that. Some patients have nasal polyps, which you wouldn't know unless you're constantly having the nasal obstruction. So patients that have like the allergic rhinitis symptoms year round will come in to see an ENT, and then we'll get them started on a nasal spray. We'll take a look at the nose or the inside of the nasal mucosa. And then really you need a nasal endoscopy, which is that thin little camera that goes in through the nose and then looks at the back of the nose and the throat to take a look and actually see the polyps. And in that case, there's further treatment needed. So stronger nasal steroid sprays that you need to try to use. And then if that doesn't help, they may need like a polypectomy surgery or a PanFest, which is like a sinus surgery that you're asleep for to get those polyps removed. And then, so this brings me into my next point of allergy testing. So there's a couple different ways to have allergy testing done. There's a blood test, which is, it's less sensitive, but it's a quicker way to test for allergies. Sometimes patient symptoms are so bad they can't discontinue using antihistamines for like 7 to 10 days, because what we recommend is like the skin testing, but you can't have any sort of antihistamine. So not the nasal spray or the oral antihistamine pills. But if your symptoms are so bad and you can't just stop taking it, then we'll do the blood test. So there's those two types of testing that you do. You can diagnose allergic rhinitis without the testing. The purpose of testing is to figure out what exactly patients are allergic to, because the next step in treatment, if they've tried all this, all the, the nasal sprays and the rinses and the lifestyle modifications and the oral antihistamine pills, is to do immunotherapy. So allergy shots, they're available in injections and oral drops that you put sublingual drops under the tongue. In my experience, not all insurances cover sublingual drops, so it's more expensive. But what they do is when you get the panel of the allergy testing results of what everything is that the patient's allergic to, they basically there's this company that makes these vials, but they send it to them and they take little drops of each thing that you're allergic to, and they make a vial of it. And each week you have an injection of the things that you're allergic to, and the dose slowly increases so that it's immunotherapy. So your body's being exposed to these allergens, and over time, it's about like a 2 to 3 year commitment.
Okay.
And then the other thing is there's injection, like biologics that you can do. So Dupixent is one. There's a couple different ones. In ENT, we don't really use that many of those, but that is a case where patients would be on it. For nasal obstruction caused by allergic rhinitis, so the septal swell, the turbinate hypertrophy, those kinds of things, there's a couple of procedures. So we use radiofrequency ablation, so to shrink the septum, or the swell of the septum, as well as the turbinate. So it's called a turbinate reduction or a septal swell reduction. It's basically like a little like tip of a pen, like a little rod that zaps the tissue and shrinks it down. And then there's another procedure, it's called Rhinair. So for patients who have like that runny nose that doesn't stop, first line we try, the nasal rinses and all those things and the sprays. And if that doesn't help, there's another nasal spray. It's ipratropium bromide, and it helps dry the nasal mucosa. And then if that doesn't work, we do the Rhinair, which is it's a little rod that zaps the posterior nasal nerve. It's a bundle of nerves that causes that rhinitis. There's another procedure, it's called Clarifix. They're just different companies that make the tools to use them. All of those focus on shrinking down the nasal mucosa for the nasal obstruction, which is it's a result of the allergies that are causing it.
So we talked about lifestyle, we talked about the typical medications and like how to add those on. You talked about some of the side effects of the nasal steroids, which I think is really important. It's drying up the nose. It can cause nosebleeds. Is there any timeline of how long you're supposed to use those, or like any tolerance that you develop if you use it long term? Like, do you have advice on that?
Yeah, so with nasal steroids, as long as you're not having any sort of like symptoms like the dryness, you can use them long term. I mean, like I said, if you move somewhere else and you don't need it anymore, stop taking it. With oral antihistamines, yes, it is more common for patients to develop a tolerance. So once you kind of hit that threshold, I mean, you can take it until you feel like it's not working anymore and then switch. So if you've been taking Claritin, which is cetirizine, for like, sometimes it happens as early as 3 months, sometimes it doesn't happen for like 5 years. It's just really dependent on the patient. Then I recommend changing to something else. So like Zyrtec, which is loratadine, and then you could try Xyzal or Allegra, just whatever. And then you can, after enough time, like a year or two have passed by, you can circle back, and usually the antihistamine should work again.
Okay. So it does work to switch the
Mhm.
type of antihistamine.
Yeah,
Interesting. Okay.
yeah. So for myself, like for example, Claritin does not work for me anymore, but Allegra does. So I've just been sticking to Allegra for some time, and when it stops working, if it does, then I'll just switch to a different one.
Okay. That's helpful to know. Okay, what about natural remedies that a lot of people swear by? So I'm thinking about honey, propolis, or any other natural. I actually have one called Boiron, Boiron. It's like a little sublingual pill that you dissolve under your tongue. And it's kind of effective depending on where you live. So what do you know about those? Are there good studies on them? How do you recommend them to patients?
Yeah. So honey is like the biggest one that you hear about. And the concept of it is supposed to be like an oral immunotherapy, basically like the shots I was just explaining. But it basically, the theory suggests that consuming small, consistent doses of the allergen over time can gradually desensitize the immune system. But unfortunately, the studies haven't proven that it helps. It's because the type of pollen that's available in the honey, even if you're buying local honey, it's different than the one that's causing like allergens. But if it's working, then why not take it? I
Yeah.
think the reason that honey specifically works for people is because it's thick and it's coating the throat when you're swallowing it. So it can cause like a soothing effect. Maybe it can like desensitize the coughing trigger. So if it's working, and you take it with hot tea sometimes, and that helps as well, like the hot fluids. So I wouldn't like recommend against it. I tell patients, if it seems to be working for you, then keep using it.
Yeah. I was reading, so I guess the bees pollinate the heavy pollen, like they pick up pollen from like flowers mostly. And that's what's actually getting in the honey. But the allergies, like the pollen that we are exposed to, are it's the light pollen that's like blowing in the wind, coming off of grasses and trees and stuff. So it's not even the same pollen. And then also the amount of pollen that's been getting picked up and put in honey is not enough to actually cause like true immunotherapy.
Yeah.
But honey is delicious,
Yeah.
and it's like an antioxidant, antimicrobial. So it's kind of like there's no harm
Yeah.
other than
There's no
the
harm.
sugar. But yeah,
Exactly. Yeah.
I do feel like propolis is kind of the rave right now. Do you have patients taking that? Either it's like oral nose spray or a throat spray, and it's made from like resin from pollen. But I just know so many people are using beekeepers natural. It's like for colds, and a lot of people use it for allergies too. And then a lot of people like eat pollen, like ingest pollen. It's all very interesting. The thing is, there aren't good studies to show that it actually works, but it's again one of those things I kind of think of it as honey, where it's like there's no harm and it's kind of like a superfood, like it comes with a lot of antioxidants. But yeah, I'm not surprised. Like you can't really recommend it if there aren't studies showing that it's
Yeah.
actually effective and worth your money.
Yeah.
So I'm curious. So if you're like me and you like to tough it out and like not take meds for whatever dumb reason, is there any harm in taking any of these medicines? And also, is there harm in not taking medicine and toughing it out and just being congested for a month or months on end?
So the goal when it comes to allergies specifically, if you don't have like polyps or other things or actual sinus infections, no, the goal of treatment is or therapy is just to make your symptoms better, symptomatic improvement. So really you have to kind of discuss with the patient what their expectations are, what kind of outcome they want. But if nasal obstruction is not the issue, there is no harm in just leaving it untreated. I mean, it's annoying to just be congested. When nasal obstruction comes into play, it can cause like obstructive sleep apnea if there's enough obstruction. And so that's where it kind of you want to figure out if it's causing that, because especially with like polyps, or just if you have enough turbinate hypertrophy and septal swelling, your nasal airway isn't very open, then yeah, you will have problems with sleep apnea. But that also
makes
has to
sense.
do with the anatomy of the tongue and the back of the throat. And there's a lot of other factors that play into it. Body habitus, genetic predisposition. So a lot of other things. But if it's causing enough obstruction to where you can't breathe through your nose, then you do want to treat it.
Mm.
And
What
if it is like just a seasonal allergies thing for like a month or two, there's no harm in the antihistamines and the nasal sprays and everything.
when I was looking up proven natural remedies to help with allergies, that's like the only thing that has been shown in randomized controlled trials to be effective is the nasal saline rinses.
Yeah,
So
I mean, think
if you're
about it. Like
trying to avoid it,
when you're outside and you're breathing in all that pollen and it's getting stuck in the nasal cavity, when you come in and rinse it out, that it's getting it out, and so your body's not reacting to it as much
Mm.
because it's gone.
yes.
I might need to start doing that. I have a lot of like post-nasal drip, but I'm a good case study for the Flonase because I had really, really bad nosebleeds following Flonase. And like, were you
Yeah,
probably the
yeah,
one that, yeah,
yeah.
like a
But
2 hour nosebleed? Like it was a lot happening. You would have loved to pack me up because it was crazy.
so that
I
was
was trying to do it myself.
that was around the same time. That was a few months ago. I think when the weather was just changing to like the cold weather, that dryness can really
Hmm.
affect it and dry out the nasal mucosa, and then it can cause worse nasal bleeding. But if you want, if you would like absolutely have to use Flonase, you can also use I think Neilmed actually makes it. Let me see if it's on here. But there's like a nasogel that you can get, and it's just like a lubricating agent, and you just spray it in your nose in between the Flonase sprays, and it keeps it moist.
Hmm. And that would help with like post-nasal drip and irritation or just,
No, just the dryness of the nose. But if
okay.
you're saying like the Flonase was helping with that postnasal drip that you were having,
Mhm.
then just add that in so you don't. I mean, if I were you, I wouldn't use Flonase again. You could
Okay.
try Nasacort, but also incorporate a sort of lubricating agent.
Okay, good to know. Yeah, and I was putting like Vaseline in my nose and you were like, "Don't do that."
No, it can cause that like lipophilic pneumonia. Have you? I mean, Chris, you would know about that more than I do. But yeah, that's what
Yeah.
I was always taught. I mean, if you've used Vaseline before, I mean, I'm not concerned. You know, you're not having symptoms, but yeah, don't use it.
Mhm.
I would just use like a nasogel or something that Neil Med makes it.
Yeah.
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 Use something
Good
that's
call.
intended for the nose.
Yes, okay.
There's also another one called Ayer, like AYR nasal spray. That's also another lubricating one. I would use that. I think this Neil Meta it's designed by like this guy Dr. Meta. He's an actual ENT. So
Cool.
The other random tidbit that I've heard that helps is if you're getting really raw, what are these called? Nares?
yeah,
If you're getting raw nares, the opening of your nose from just like always wiping it and being sniffly, you can use the lubricating thing, but you can also spray hypochlorous acid. So that's like Magic Molecule or Active Skin Repair, common brands, just like to those areas. It's safe for the outside of the nose and it will help decrease the inflammation. So
Mm.
I've been doing that for me and for Palmer because we're both kind of just like sniffly and I feel like it's helping.
Oh, good, good. Yeah,
Yeah.
Aquaphor on the outside of the nair is also fine.
Yeah. Just don't be like shoving it up
Yeah.
into the brain.
You can
Yeah.
also, if you have bacitracin or mepiricin ointment, you can also put a little bit of that on the outside as well. That's what we put on the inside after we cauterize the nose, just to help keep it
Mm.
moist. And it's antimicrobial bacterial. So
I feel similarly to Cruzy, for some reason, like very hesitant to take something.
Mhm.
So it's nice to know that there's not many like contraindications for taking the oral or nasal antihistamines. So maybe on the days when I'm really down bad, oh, not maybe. On the days when I'm really down bad, I will be quicker to like do some of these things just to, yeah, like make my symptoms better and have a better day because they can really ruin your
yeah,
day.
Well, that was great. We're going to share with all of our friends. Thanks for bringing all your props. I loved
They're
it.
helpful. You got to get the hand though. You got to get the like, you know,
Oh
influencer like
yeah. Okay, guys. I
Yeah.
like don't know what I'm doing. Well, thanks for having me.